If you have felt your memory slip names hiding on the tip of your tongue, or you walk into a room and forget why you came in, stay with me, because in the next few minutes you'll discover the simple blood tests that can help protect your brain. After 60 and give you real peace of mind, I will show you which numbers matter, why they matter, and how to talk to your doctor with confidence, so you can feel clearer, steadier, and more you. My name is Dr. William Harper. For over 3 decades, I have sat across from men and women in their 60s, 70s, and 80s who whisper the same fear. I am scared of losing myself. I hear you. You want to stay sharp for the people you love. You want to remember the stories your grandkids ask you to tell again. You want to wake up with a steady mind and a steady step. That is not too much to ask. And yes, there are science-backed ways to check your inner chemistry, so your brain gets the fuel and balance it needs. Here is our promise for this video. You will learn the blood tests worth discussing with your clinician for brain health after 60. You will understand in plain language what each test is looking for and how it relates to memory, focus, and mood. You will get simple ways to prepare for a better appointment, so your questions are answered and your plan is clear. And at the end, I will share a quick at-home brain check you can try with only a pencil and paper. So keep watching. First, let us talk about why blood work even matters for the brain. Your brain is a power-hungry organ. It needs steady sugar delivery, clean blood flow, healthy fats, and vitamins that act like tiny toolkits. When any of these are off, even a little, you may feel foggy, tired, or blue. Picture a lamp with a loose cord. The bulb is fine, but the current flickers and the room goes dim. The right tests help us find the loose cord so we can plug it in firmly again. In this series, we will focus on a handful of lab checks that cover the most common hidden causes of brain fog in older adults. Blood sugar balance measured by fasting glucose and A1C, because wild swings strain brain cells like a roller coaster ride that never stops. Vitamin B12 and something called MMA, which tells us if B12 is actually getting into your cells, because low B12 can mimic memory trouble. Vitamin D, the sunshine helper that supports mood, immunity, and brain signaling. Thyroid tests like TSH and free T4, because a slow thyroid can make you feel slowed down in body and mind. Cholesterol and triglycerides, the lipid family that shapes blood vessel health, because healthy circulation means a well-nourished brain. Inflammation markers such as HSCRP and homocysteine, since chronic simmering inflammation can nudge cognition in the wrong direction. Omega-3 index, which reflects the brain. Friendly fats you get from fish and certain seeds. Basic kidney and liver panels, because these organs clear waste and help activate nutrients. And when they struggle, the brain often feels it first. I will translate each of these into everyday language in the next parts. No jargon, just clear pictures of what is happening in your body and what questions to bring to your next visit. For example, when we discuss blood sugar, you will learn why a steady river is safer for your neurons than a tidal wave. When we cover B12, you will hear how this vitamin helps build the insulation around brain cells, the way a good jacket keeps you warm. On a windy day, you might be wondering, do I need all of these tests? The short answer is that your history guides the list. If you have numb toes, tingling fingers, or long-standing diabetes, then sugar markers move to the front. If you follow a plant heavy diet or take acid blockers, B12 may be key. If you rarely see the sun and feel achy or low in winter, your vitamin D might deserve attention. Part of being wise with your health is choosing what matters most for you, and that is exactly what this video will help you do. I also want to reassure you, numbers are not a judgment of your worth. They are a map. A map tells you where you are and points to a better path. When you see your labs as a map, you stop feeling blamed and start feeling empowered. Imagine leaving your next appointment with a simple plan and a lighter step. Few tiny tweaks to food, movement, sunlight, and supplements, when appropriate, can brighten your inner weather. More than you expect. Stay with me, because halfway through this series, I will reveal the one result that surprises most people. It is not a standard brain scan, and yet when we address it, many seniors report better focus and steadier mood within weeks. And at the very end, I will guide you through a fast pen and paper self-check that takes less than 1 minute. You will like how practical it feels. Asterisk. Let us start with the fuel line to your brain. Sugar in your blood. Your brain runs mostly on glucose, and it does not store much for later. It needs a steady river, not a flooding storm, and not a dry creek. When sugar surges high, then dives low, you may feel foggy, shaky, or oddly irritable. When the river runs smooth, your thinking feels calmer, and your focus returns. 2 simple tests help us read that river: fasting glucose and A1C. Fasting glucose is a snapshot after a night without food. A1C is a photo album covering roughly 3 months. Sugar sticks to red blood cells like honey on a spoon, and A1C tells us how sticky that spoon has been over time. Together they reveal patterns that a single reading can miss. Why this matters for your mind. When blood sugar swings wildly, your brain cells ride a roller coaster. Nerves prefer a gentle train on a straight track. Stable glucose supports the tiny energy factories in your neurons. It keeps inflammation quieter and helps your brain chemistry stay balanced for memory and mood. Picture yourself reading the morning news with ease, or finishing a phone number without losing the last digits. That is the power of a steady river. How to prepare so your numbers truly reflect your daily life. Sleep as you normally do the night before. Unless your clinician advises otherwise, aim for a simple overnight fast. Water is fine. Avoid unusual heavy exercise right before the draw, since a hard workout can nudge numbers temporarily. Bring a list of your medications and supplements. If you are ill or under unusual stress, tell the nurse, since those can also shift readings. Jot down 2 or 3 symptoms you notice, like mid-afternoon brain fog or after-dinner fatigue. Those notes help your clinician connect the dots without you feeling rushed. What to ask at the visit so you leave confident. Ask how your fasting glucose and A1C fit together based on your history. Ask whether a fasting insulin or a simple after-meal glucose check would add clarity for you. Some people feel foggy 2 hours after eating, and that timing can be informative. Ask what lifestyle changes usually move the needle most for someone like you. And finally, ask when to recheck so progress does not float into uncertainty. You want a gentle at-home awareness check. Try this on a normal day. Notice how your brain feels 2 hours after breakfast, lunch, and dinner. Use a small notebook. Write clear, sharp, steady, or write heavy, foggy, slow. No judgment, just a map. After a week, you may see a pattern that points to helpful tweaks, such as shifting breakfast toward protein and fiber, or adding a 10-minute walk after the largest meal. Simple does not mean small. Simple often means sustainable daily habits that support steadier numbers and a clearer mind. Build meals like a balanced plate: half colorful vegetables, 1/4 protein, 1/4 slow starch, such as beans, oats, or sweet potato. Start the day with protein to prevent mid-morning crashes. Think eggs or Greek yogurt, or a warm bowl of lentils if you prefer plants. Add fiber you can see, like berries, leafy greens, chia, or flax seeds. Fiber slows the sugar river to a safe glide. Move your body after meals. Even 5 to 10 minutes of easy walking helps muscles soak up excess sugar like a dry sponge. Prioritize hydration, since thick, sluggish blood moves slowly through brain vessels, while well-hydrated blood flows smoothly. If you drink alcohol, discuss timing and amount with your clinician, since evening drinks can push night and morning sugars in the wrong direction for sleep and cognition. I want you to feel encouraged here. You are not trying to be perfect. You are learning how your body responds when your numbers begin to settle. You may notice brighter mornings, steadier mood, and a calmer pace to your thoughts. Imagine walking into a room and actually remembering Why you came in, imagine finishing a conversation without losing your thread halfway through. That confidence is worth the care you are taking. Stay with me, because in the next part, we will tackle vitamin B12 and MMA. This pair often surprises people. When B12 is low, the brain can feel older than it truly is, and correcting it can bring back energy and clarity faster than you expect. Remember the special tip I teased at the start. We are getting closer to the result most seniors overlook. Yet it quietly affects focus, mood, and even sleep. Do not miss it. Today, we turn to vitamin B12 and its partner, check MMA. If your mind has been feeling older than your years, if your feet tingle at night, or you lose your balance on a dark staircase, B12 may be part of the story, and it is one of the most correctable causes of brain fog after 60. Think of each brain cell as a live wire carrying tiny messages. Those wires need insulation called myelin to keep signals fast, and clean B12 helps your body build and maintain that insulation. When B12 runs low, the coating thins, the message leaks, and your thoughts can feel slow or scattered. You might search for a word mid-sentence or read a page and realize you did not absorb it. Some people feel low mood or a nervous edge they cannot explain. Others notice a burning tongue or a heavy, tired feeling that coffee never fixes. Now, here is where lab work becomes powerful. Most people start with a simple blood level for B12. That test is helpful, but not the full picture. B12 can look normal in the blood while your cells are still starving. That is why I often pair it with methylmalonic acid, or MMAMM. Arises when your cells cannot use B12 properly. If B12 is your fuel, MMA is the exhaust. Too much exhaust tells us the engine is not burning clean, even if the tank looks full. You may also hear about homocysteine, a small molecule that climbs when B vitamins are low, and it is linked to both vessel health and cognition. We will go deeper on that in the next part, because it is one of the most overlooked results in seniors. In changing, it can brighten focus and mood within weeks. So keep watching. Who is most at risk for low B12 after 60? Anyone with reduced stomach acid, since acid helps free B12 from food. That includes many older adults and people who use acid-blocking medicines for reflux. Metformin, a common diabetes medicine, can also lower B12 over time. Strict plant-based eaters who do not use fortified foods may run short because natural B12 is concentrated in animal foods. People with a condition called pernicious anemia have trouble absorbing B12 in the gut due to an antibody that blocks a helper protein past stomach or intestinal. Surgery can reduce absorption. To how to approach testing so the results truly guide you. Bring a list of your medicines and supplements to the draw. If you are taking high-dose B12, already tell your clinician, since it can raise the blood level. And blur the picture. Morning draws are often convenient, and you do not have to fast for B12 or MMA alone, though your clinician may pair them with other fasting tests. Ask your clinician to interpret B12 together with MMA and possibly homocysteine rather than using a single cutoff. You deserve a clear explanation, not a shrug. What numbers mean in plain language. A healthy B12 with a low suggests your cells are getting what they need. A borderline B12 with a high MA suggests your tissues are running lean, and a plan could help. Elevated homocysteine adds a second clue that methylation chemistry is strained, which can affect vessel lining, mood chemistry, and memory pathways. Remember, these are guides, not grades. The goal is not a perfect score. It is a brain that feels alive and dependable for your daily life food and lifestyle steps to support B12 while you work with your clinician. If you eat animal foods, rotate options like salmon, tuna, sardines, eggs, and dairy if tolerated. If you prefer plants, look for fortified nutritional yeast plant milks or cereals, and check labels for B12. Support your stomach by eating slowly and chewing well, since digestion begins in the mouth. Aim for a calm 20-minute eating window without rushing, so your body has time to extract nutrients. If you drink alcohol, keep it modest, because too much irritates the stomach lining and steals nutrients your brain needs. Supplement plans vary, so partner with your clinician. Some adults do well with daily oral B12, such as cyanocobalamin or methylcobalamin. Others with absorption issues may start with weekly or monthly injections, then transition to oral maintenance if homocysteine is high. A combined approach with folate and B6 may be discussed, since these vitamins work as a team in methylation chemistry. The point is not to collect bottles. It is to choose the fewest steps that move your energy, memory, and mood in the right direction. Simple self-awareness checks you can try at home while you pursue testing. Close your eyes and gently rub a cotton ball across the top of each foot. Compare left and right for sensation, but do this seated and safely. Notice your balance when you stand. Still at the kitchen counter, hands hovering over the surface for safety, and eyes open, then closed for a few seconds. If one side feels dull or your balance wobbles more than usual, jot it down and share it at your visit. These are not diagnoses. They are clues that help your clinician tailor care to you. Let me reassure you, when B12 is the missing piece, people often feel a brighter mind and steadier steps within a short season. I have watched grandparents tear up as they tell me they can follow a story again or finish a crossword without giving up. That is the kind of win I want for you. Are about halfway through our guide, and the best is coming next. In part 4, we will talk about the quiet chemistry that ties nutrients to your blood vessel lining and your sleep and mood rhythm. Yes, we are talking about homocysteine and inflammation markers, and you will learn exactly how small changes can bring those numbers into a healthier range. Stay with me, because at the very end I will share a pencil and paper brain check that takes less than 1 minute and gives many of my patients a rush of confidence. Now we open the door to a quiet number that often surprises people. Homocysteine. If your brain has felt a little older than your heart feels inside, if your sleep is choppy, or your mood dips without a clear reason, this number may be part of the story. And the good news is it is changeable. Think of homocysteine as a small byproduct from your body's daily repairs. Like sawdust on a workshop floor, it is normal in small amounts. Your body sweeps it up and recycles it using helpers from the B vitamin family, especially B6, folate, and B12. When those helpers run short, the sawdust piles up and begins to irritate the space in your body. That irritation can nudge the lining of blood vessels and the delicate chemistry that carries signals in your brain. Higher homocysteine has been linked with foggier thinking, slower recall, and a heavier mood. In older adults, lowering it supports cleaner vessel function, steadier neurotransmitters, and a calmer mind. Testing is simple. Homocysteine is a standard blood draw and does not require fasting by itself. Your clinician may pair it with other fasting labs for convenience. If you already supplement with B complex or high-dose folate, let your clinician know, since it can shift the number. Ask to see homocysteine alongside B12 MMA, and if measured folate, since the pattern tells a more useful story than any single value. What to ask in the visit, so you leave with clarity. Ask what might be personally raising your homocysteine. Low intake of leafy greens, legumes, and eggs. Low stomach acid or reflux medicines affecting B12 limited sun. Exposure or low vitamin D, which can amplify inflammatory tone. Smoking, dehydration, and long sedentary stretches can also tilt chemistry the wrong way. Then ask for a simple plan with a recheck date so you can see progress rather than guessing daily. Actions that gently lower homocysteine and support brain flow. Build a leafy habit. Add a fist-sized serving of spinach, kale, arugula, or mixed greens most days. Legumes like lentils and chickpeas bring natural folate and fiber. If you eat eggs, consider one with breakfast, since eggs carry choline, a teammate in methylation chemistry. If you are plant-forward, look for a fortified B12 source and consider a conversation about a low dose. Be complex with your clinician walk after your largest meal. 10 easy minutes counts. Movement is like turning on the workshop fan. It clears the air. Drink water across the day so your blood moves like a smooth river rather than a thick stream. Tend your sleep routine with a steady lights downtime and a gentle wind down ritual, since poor sleep stirs inflammatory sparks that raise this number. Now meet its cousin, high sensitivity C reactive protein, or HSCRP. This is another simple blood test, and it acts like a smoke detector for simmering inflammation. It does not tell us where the fire is. It tells us that somewhere in the body, sparks are active. Those sparks can come from gum disease, achy joints, extra visceral weight, poor sleep, stress, or even an infection you are shaking off. For the brain knows. Sparks matter because inflammation can make signals sluggish and attention short. Many seniors tell me their thinking feels clearer in the same season. Their HSCRP slides down. How to work with HSCRP in plain steps. Ask your clinician to review the number in context with your story and other labs. If it is elevated, look for simple fixable sparks first. Tender gums or bleeding when you floss, call your dentist. Late, heavy dinners and restless nights, tighten your plan for earlier light meals. And a calm bedtime routine. Long hour sitting, set a timer for stand and stretch breaks every hour or two. If joints feel hot or swollen, ask whether a gentle anti-inflammatory approach like supervised physical therapy or weight-bearing movement would help. Nutrition that helps includes colorful vegetables, berries, olive oil, nuts, seeds, and omega-3 rich fish like salmon, sardines, or trout. Speaking of omega-3s, you may also discuss an omega-3 index. This blood test estimates how much brain-friendly fat gets into your red blood cell membranes. Imagine those membranes as the hinges on a door. With enough omega-3, the hinge swings quietly and quickly. Too little, and the hinge creaks. While we will not chase every number higher than needed, many older adults feel a steadier mood and attention when they bring this index into a healthy range through food and, when appropriate, a clinician-guided supplement. Let us tie these together with an easy picture. Homocysteine is sawdust. HSCRP is the smoke alarm. Omega-3 is the oil on the hinge. When you sweep the floor, lower the smoke and oil the hinge. Your room feels calmer and clearer. Your brain is that room. A few practical meal ideas to make the chemistry friendlier this week. At breakfast, build a greens and eggs plate or a warm bowl of oats topped with ground flax, chia, and blueberries. At lunch, try a lentil soup with a side salad and olive oil. At dinner, enjoy salmon with lemon or a chickpea and spinach stew seasoned with turmeric, ginger, garlic, and herbs for gentle anti-inflammatory support. Finish the largest meal with a slow stroll around your home or down the hallway. If the weather is rough, one more often missed spark mouth health. Inflamed gums send constant distress signals into the bloodstream. Asterisk. We are going to finish your brain health map with 4 quiet but powerful checkpoints: thyroid, vitamin D, lipids, and the kidney and liver panels that keep your inner housekeeping steady. And I will guide you through the 1-minute pencil and paper self-check. I promised simple, friendly, and surprisingly revealing. First, the thyroid. Your thyroid is like the dimmer switch for energy in every cell, including your brain. When it runs slow, you may feel heavy in body and in thought. You might nap more, lose words more, and move through the day like you are wading through water. 2 common labs lead this conversation: TSH, the signal from your brain to your thyroid, and free T4, the hormone your thyroid releases. Together they show whether the switch is set too low or too high. If your symptoms sound thyroid leaning, ask your clinician about checking these together, and sometimes free T3 if questions remain. Tell your clinician if you take biotin hair and nail supplements, since biotin can confuse some thyroid tests and should be paused before the draw. As advised, if a change in thyroid medicine is made, ask for a simple follow-up plan, because the brain often notices when the dose finally fits just right now. Vitamin D, the sunshine helper. The lab you will hear about is D25OH, which reflects. Your stored D-level healthy vitamin D supports mood immunity and the way your brain cells talk with each other. Low levels are common in older adults, especially if you spend little time in direct sun or live at higher latitudes. Ask to see your D25OH in plain numbers and ask what range your clinician feels is appropriate for you, given your bones, heart, and brain. If a supplement is discussed, ask about gentle daily dosing and whether magnesium-rich foods or a magnesium plan would support you, since magnesium helps activate vitamin D in the body. Pair this with a short outdoor walk when weather allows, so you nourish both chemistry and spirit at the same time. Next, your lipid panel, the family of fats that shape blood. Vessel health. Your brain thrives when its supply lines are clean and flexible. Core pieces include LDL, the cholesterol most linked to plaque risk, HDL, the scavenger that helps carry cholesterol away, and triglycerides, the fat that rises with sugary refined foods and long stretches of sitting. Ask your clinician to explain your pattern, not just a single value, because the pattern tells the story of your vessels. A gentle shift toward fiber-rich meals, beans, oats, berries, leafy greens, olive oil, and omega-3 fish like salmon or sardines, plus easy after-meal walks, often improves this panel in the same season. People report a clearer head and steadier mood. If you are on lipid medicine, ask how it pairs with your other medicines and what lifestyle steps still move the needle, so you feel like an active partner, not a passenger now. The kidney and liver panels, the unsung caretakers. Kidney tests like creatinine and estimated GFR tell us how well you are filtering the blood. When kidneys are overworked, waste can linger, and you may feel heavier, foggier, or more tired than usual. If you live with diabetes or high blood pressure, ask whether a urine microalbumin check is appropriate, since it can spot early strain on kidney. Filters liver tests like AST/ALT and GGT show how your liver handles detox and nutrient activation. A taxed liver can make you feel sluggish, irritable, or off in appetite. Ask whether any medicines or supplements should be timed or adjusted. To be kinder to these organs, and remember that hydration, movement, and a colorful plate are simple gifts both organs appreciate. How to bring all of this into one clean conversation with your clinician. Bring your medication and supplement list even. Over-the-counter items and vitamins. Arrive with 3 questions written on a card. 1. What are the 2 or 3 labs most relevant for my brain health story? 2. What simple steps could move those numbers in the right direction for me over the next 8 to 12 weeks? 3. When should I recheck so we can see progress, not guess? If a result worries, you ask how it fits your personal map rather than comparing yourself to a neighbor. Progress is personal, and the goal is a mind that feels reliable for your real life now. The 1-minute pencil and paper self-check I promised. This is not a diagnosis. It is a friendly snapshot you can repeat once a month to notice trends. Grab a pencil and a blank half sheet. Set a timer for 1-minute step. 1. Write these 3 words on the top line: apple river lamp. Then draw a small box around them and cover the box with your hand so you do not stare at the words. This seeds your memory gently. 5-second step 2. Draw a circle the size of a teacup. Place the numbers like a clock face. Then set the hands to 11:10. One hand near the 11 and the small hand a little past the 11. 35-second step 3. Uncover the box and look away from the paper. Say the 3 words out loud. From memory, apple river lamp. Then write them down without peeking. If you miss one, do not judge, simply note how many you recalled. 15 seconds. When the minute ends, look at your page. Did the clock look tidy where most numbers in the circle were? The hands placed cleanly. Did you recall 2 or 3 words? Jot the date and how you felt repeat next month and watch for steadier scores. If you notice a clear slip, share the pages with your clinician. You will be surprised how empowering this tiny ritual feels. Before we close, let me bring all the threads together. Your brain is not asking for perfection. It is asking for steady care. A smoother sugar river, a well-fed nervous system with B12 and vitamin D, a calmer inflammatory signal. Through homocysteine and HSCRP, well-oiled hinges from omega-3s. Healthy vessel flow from a kinder lipid pattern and the quiet strength of kidneys and a liver that can do their work without strain. Small daily choices make big quiet differences. Imagine walking with more energy, remembering names with ease, and ending the day with a calmer mind. That future is possible, and it begins with one practical conversation and a few gentle habits. If this guide helped you, type clear mind in the comments, so I know you are with me. Share which lab or tip surprised you most, or tell me about your first 1-minute self-check so other viewers can learn from you. I am Dr. William Harper, and I am proud of the care you are taking for the person only you can be. A soft brush twice daily, a gentle floss routine, and a dental check can lower HSCRP while protecting memory and heart health at the same time. If floss is tricky, ask your dentist about water flossers or interdental brushes. Small moves add up. Keep watching, because in the final part, I will show you how thyroid, vitamin D, lipids, and kidney liver panels fit into your brain health map, and how to talk with your clinician so you are not overwhelmed. And as promised, I will guide you through a 1-minute pencil and paper self-check that many of my patients love. It is simple, friendly, and gives you a quick snapshot of attention and recall you can repeat each month to see your progress. Asterisk.